Hi, I'm Dr. Hillary Lampers, naturopathic physician and neurocranial restructuring specialist. Today I wanted to discuss breathing disorders. If you've ever been diagnosed with sleep apnea, chronic sinusitis, deviated septum, and been told you need surgery to repair these things, neurocranial restructuring might be a great treatment for you. Breathing is not overrated, meaning breathing through your nose is very important. If you do suffer from sleep apnea, then you understand what this means. At night when you breathe, you need to be able to breathe through your nose efficiently, or you breathe through your mouth. During sleep apnea, in the back of the throat, some people have tissue or whatever fall down and their airway is not big enough, and therefore they can not get enough air or oxygen to the brain. They wake up multiple times during the night because their brain is trying to get oxygen, but it can't. And so they wake up in the morning, sometimes feeling like they got hit by a train after a full 8 to 10 hours of being in bed and sleeping. When you've had sleep apnea, usually the diagnosis for that is a CPAP machine. When you wear the CPAP machine, you start to realize that you do feel better because the CPAP is blowing air down and giving your brain oxygen. NCR can help sleep apnea because it can actually change the airway space behind the nose in the upper pharynx where air goes through your nostrils and back. It can actually change the diameter and space back there to help with that breathing. Of course, sleep apnea, it's important to lose weight, improve your diet, remove allergen foods, but structure is a very important piece of it, and if you're not addressing that, you're going to continue to have problems. So NCR is a great treatment to help sleep apnea. Right now, the statistics show that about 28.5 million people in the United States suffer from chronic sinusitis. Chronic sinusitis is a chronic inflammation of the sinus cavities, which you have in your skull, and sometimes the airways themselves, which are the nasal passages, and from inflammation. That can also be as a result of having poor airway space. So if the airway space is not big enough, then you're not going to be able to get air through, and the tissues will get more inflamed because your air is a filter. It's a natural filter, and if it can't filter properly, that stuff sits in there. So think of commuting to work, you're breathing in that smell, and you're, if you live like in Phoenix, there's dirt in the air, and if you live in, by the ocean, there's salt and sand, all these things, and so you're constantly having to filter it, and they'll get stuck in there, and they'll cause chronic inflammation. NCR can help that by changing, again, the space of the airway and giving you more room so that that inflamed tissue doesn't make such an impact. Again, lifestyle is also very important for chronic sinusitis. A great way to give you more space in your nose is to fix a deviated septum. Many people have deviated septums related to head traumas, blows to the head or face. Some people are born with them. But the septum is in the middle, and it can be not in the middle and can decrease the airway space. So neurocranial restructuring can actually improve septum deviation without surgery. Nasal surgeries are big business, and I'm not totally against them, but I believe that there are modalities like NCR that can help patients get better airway space without having to have the more traumatic surgeries. So breathing is really important. Neurocranial restructuring is a great modality to think about if you want to breathe better through your nose and just feel better in general.